We're talking about the Pharmaceutical Workforce Development Goals with the Director of the World Health Organization Health Workforce Department, Jim Campbell, at the Global Conference on Pharmacy and Pharmaceutical Sciences Education. Jim, Goals 11 and 12 focus on having evidence of the impact of workforce development as well as workforce intelligence. Why is this so important?
Well, it's great to be with you here in Nanjing, and thank you very much for the invitation and the opportunity to speak. In the 2006 World Health Report on Working Together for Health, strategic workforce intelligence was one of the critical areas put forward that we need to advance. We need to understand the active health workforce if we're going to have evidence-informed policy options. That work, unfortunately, continues to be challenged in terms of understanding across all member states of the world. For pharmacy and pharmaceutical science, it's even more important. As the High-Level Commission on Health Employment has just demonstrated, we are one of the largest, most significant economies, industrial sectors in many, many countries. And yet we still have an absence of data in terms of that information. So it's absolutely critical. It's encouraging to see FIP putting this forward, and the roles of national associations will be critical to actually understand who's registered, who's licensed, where are they working, what are they doing, so that we can bring that information together to start to inform some of the policy options that we need to take forwards. In terms of the second part of this, in terms of looking at the workforce impact, we have been, with the High-Level Commission and the Global Strategy on Human Resources for Health, we've been trying to build the narrative around the economic benefit of the health workforce, because we are an active, dynamic labor sector which has all these other benefits. The Agenda for Sustainable Development enables this opportunity for a new discussion, a new narrative around the additional benefits rather than just health outcomes, as critical as they are, but the additional benefits around innovation, qualities, gender. So we're looking at the opportunity to improve our understanding around the social return on investment, around the employment of healthcare workers, not the cost benefit of one type of health worker versus another, not looking at whether or not a health worker with 3 years education is cheaper than a health worker with 5 or 6 years education, but actually the return on investment through their career pathways in terms of some of the less tangible elements. That work demonstrates in the pharmacy sector. We've seen from some of the available evidence, the available literature, just take prescribing and rational prescribing behavior and the regulatory frameworks. In those countries where we have a strong regulatory environment, where the education, the skills and competencies of the prescriber, the pharmacy, are engaged, we can see significant savings in terms of expenditure on medicines. An estimate of over $500 million being saved every year because of the pharmacy workforce. And that's the type of information that enables us to put forward new evidence and new significant argument for why we should continue to be investing in the skills, the competencies, and the development of the workforce going forward. Unfortunately, that evidence is few and far between. And so really encouraging to see FIP put this forward and say, how can we make this science stronger? How can we get better evidence from countries so that we build a body of evidence to enable and inform the policy decisions going forward?
Well, that leads to my next question is, what are the biggest gaps in these areas?
One of the challenges that we have is, first of all, just understanding what is the active health workforce. We have, with the Agenda for Sustainable Development, Goal 3C on the development, education, training, and retention of the healthcare workforce. And that's quite a complicated indicator to measure. Not only do we need to know what we have now, but we need to understand who's coming through the education pipeline and how long are people staying in work, the retention element of it. Fortunately, and the good news is that the group responsible for this metric, this indicator at the global level, has agreed to include pharmacists and pharmacy technicians in the global measurement framework, in the global metric. And so we're calling upon FIP, upon all the national associations to partner with us in overcoming some of these data gaps. who's the active health workforce, the pharmacists, the pharmacy technicians, so that we can start to make some better understanding across countries and within countries about their number and their distribution.
So what else is needed to fill these gaps?
The solutions, the work is not difficult. The work is quite simple in terms of trying to count the active health workforce. It's quite a simplistic concept. But it needs perseverance. The challenge of trying to look at the existing data, understand whether the minimum data set that a country keeps, whether records in the professional association are similar to the types of records and the metadata in the payroll, whether it's similar to the work in the business sector that may award licenses to pharmaceutical industry companies. And so how do we standardize the minimum data set? How do we take that forward? And then how do we total that at a country level? And that's the perseverance. Florence Nightingale once said, that years and decades of perseverance can overcome centuries of tradition. And that's what we need, the perseverance to actually take forward this quite simple concept into an active live register.
Thank you. This is Whitley Yee reporting from FIP.